to ensure that the discussions continue. We have a very effective framework that can be leveraged by the private sector to be able to do what they are best at doing, which is negotiating, getting commodities that they require, and paying for it. So certainly, the discussions are going to continue, and government is open to this process. Thank you.
Thank you very much. That's very encouraging, Dr. Mukhtar. A well-earned round of applause. The aspect of even considering that the private sector reducing the burden of those who are accessing the free vaccines by, buying for their people. And they can, I know the way the private sector is structured, for whatever they are buying for their people, they will still be contributing to the government's own. So formalizing this is something that's going to be very helpful down the line. And I think one of the ways is incorporating the Healthcare Federation of Nigeria, for instance, as part of your technical working group in that steering committee. Is this something you can facilitate as well? Is a follow-on question for you, sir.
We are quite open to engagement. We have not limited any group from the Presidential Steering Committee. Anyone that can contribute to advancing the cause of either containment or mitigation is certainly open. So we'll reach out to this group and make sure that they are on board.
Fantastic. Thank you very much. Fortunately, you have on the panel the president of the Healthcare Federation of Nigeria, Dr. Pamela Ajayi, and I'm sure you can exchange your contact details. Thank you very much for that very reassuring intervention. Honorable Commissioner, sir, in your presentation, I'm hoping I didn't hear you correctly, and therefore please correct me if I'm wrong. It sounded like there were like 60% of the recent cases being typed are actually variants. Did I hear that correctly? So including the Delta variant as well. So given the way we've seen the devastation, the increased virulence and increased transmissibility of those new variants, how would you say, with the taking down of some of the facilities that were there in the earlier wave, how is government strategizing in the event, we pray it doesn't happen, of a surge or a new wave as is currently going on in Southern and Eastern Africa?
So thank you very much. Yes, indeed. I think that it was important for us to establish the demographic profile of the virus itself that's circulating, so that we're not just speaking theory that we know. And we always suspected that we had a number of variants around in the Lagos community. In fact, I believe that Lagos and Nigeria contributed to the early variants that emerged. And the reason I say that is because we picked up some of these variants quite a long time ago in Nigeria. Nobody just believed it. And the speed with which the virus was moving around in Lagos, and we already modeled that almost in March 2020. And I remember when we had a discussion amongst the modeling team, we modeled that at least 10 million Lagosians would have been affected by the end of the first wave. And we were scared to mention that figure. And I advised the think tank that we revise that modeling down to 1 million. And even though we mentioned 1 million, that in itself caused a stir. So when a virus moves through a community very quickly like that, you are going to get mutations and new strains emerging. And then, of course, it went out of the country, and what we're seeing now is, with global travel, it just shows that this virus is moving, and it's moving around the world very quickly. And just as Mr. Suleiman said, no part of the world is safe if parts of the world are being under-vaccinated. It's actually a global biosecurity threat. If you think your house is safe, you don't know what you're talking about, because a new mutant will arise in another part of the world that will overcome what you think is a safe house for you. So it's important that the world moves together on this whole initiative around vaccinating. Now, coming to your specific question, we have never stopped to build capacity in Lagos. As we speak, we're already looking at more oxygen plants. We're keeping all our isolation centers on standby. We're still engaged with the private sector for both testing and care. We're engaged with the private sector for logistics. And let me just, for a matter of emphasis, just remind the congregation here or the forum here that in a pandemic response, logistics is 60%. If you don't have good logistics, you have nothing. And it's something that we really need to pay attention to moving forward. Logistics is everything. And if your logistics is weak, your response is weak. So we're constantly upgrading our logistics. We're keeping our isolation facilities on standby. Our doctors are being trained. We're building gradual capacity. What we're focusing now on is vaccination, because that's really the way in which we're going to be able to withstand these inevitable importations of, there's no way you can stop it. These mutants are going to be imported into Lagos and into the rest of Nigeria, and they will form clusters. And those clusters will eventually spill over into the community and cause community transmission, which will trigger the third wave. So it's very important that we keep all this infrastructure on standby. We can reactivate it at any point in time. Our staff are there. We have the support from the federal. We're now that we've recovered from wave 1 and wave 2, we have a bit of breathing space to link up with federal and to, strengthen the ties and strengthen the strategies and strengthen the whole paradigm around which any part of Nigeria will respond, but particularly the focal points, Lagos, Abuja, and Kano. Thank you.
Commissioner, the road, as you so eloquently showed it in that picture with the red, green, and yellow people, is in having more turn yellow and green, and vaccination is the route to that. So the essence of that was to come back, that to prevent the need to go back to spending on isolation centers and all of that, the vaccination is the way to go. And if I come to the president of the Healthcare Federation of Nigeria, you've had a series of engagements and you've demonstrated how your members actively contributed to taking testing as one of the pillars of the response to the COVID-19 to where it is now, where there's 70% being done by private sector. With the national, have you been able to have similar inroads into other places outside of Lagos State, whether at national or state level, and is that part of your consideration? And specifically on the issue of mobilization and convincing the hesitancy movement, is there a way that the Federation can also support in that aspect of behavior change communication to, make the whole vaccination approach a success?
Thank you very much for those questions. Yes, Lagos State is ahead. It's ahead of the curve in Nigeria. And I think we all have to thank our Commissioner of Health for that. So I'd like to ask for another round of applause for him. Thank you. And Lagos has really led the way. Now, one of the things that we have done is we are working in other states to ensure that we grow in terms of laboratory testing and we work with other people, but it is not as strong, I must confess, as in Lagos State. Now, it is our mandate to do things on a national level. We are the umbrella voice for all of the private sector, for all the associations, and also in all the states. And so we are working towards achieving this. But specifically, as you asked about the communications, we have actually been working closely with Lagos State on this. As a member of the vaccine committee myself, we've actually worked with Lagos State continuously on the have come out. In addition to that, the HFN has an IT communications committee, which has been working in the social media, not only to identify some of the issues that have been arising, but also to try and create some things to combat it. At one of our last stakeholder meetings, we actually had a survey where we asked our clients and particularly our health workers why they were not taking up and why there was such a high level of hesitancy. And one of the things that came across quite strongly was the fact that they were not engaged, they didn't feel engaged, and there was an issue of trust. And one of the things that was also communicated was that if they were part of the solution, if they were a part of the administration of the vaccine, not only they themselves and their workers, but also their clients, as we have discussed so many times before. 70% of the work in healthcare is done, or the provision is done by these smaller hospitals and pharmacies and other networks. And bringing them in and allowing them to administer the vaccine, I believe, would also raise that level of trust in the community.
Thank you very much, Dr. Ajayi. Your continued engagement and involvement on several Lagos and now growing other states and national with this opportunity also, I think it will make a world of difference. It has been mentioned by almost every speaker that it's not just a supply problem. The national coordinator gave an instance, for instance, that if we track how long it took to move out just that very tiny bit of vaccine, it's something to be concerned about. And what to do is to ensure that that mobilization of the people is done by those who they can trust. Who's bearing the message also makes a world of difference. So identifying people who are well recognized as role models in society, not always government spokespeople, but the people that the people themselves, trust and follow. I think that will be very helpful. And if I come to the economics before I end up with the First Lady of West Africa Healthcare Federations, in the economics bid, the COVAX, and I heard it from Dr. Mukhtar, and I guess I would like to imagine you are probably speaking of the bilateral arrangements. For the COVAX facility, my understanding is that there are two components of it. There's the facility into which the high-income countries are making payments as an additional window to support whatever direct engagement they have with the companies. So they are paying for what they get, and they get the first cut. They have up to 50% allowance of their population to cover. For the low and middle-income countries, which are about 94 of them, they will only get up to 20% coverage of their own citizens, but they're not paying for it, right? So that's one thing I would like you to clarify at some point. But to Dr. Mukhtar, part of the advanced countries payments was to incentivize the manufacturers. They called it the advanced market commitment, right? And if we look in our environment, we have to go beyond this dependency that Dr. Mukhtar mentioned into self-sufficiency. In Africa, South Africa is now joining the realms of those who may be in a position to start producing vaccines. In the US, the Pfizers, the Modernas, they got huge investment. The Operation Warp Speed from the US government to de-risk their early research and development. So in what way is the Nigeria financial services sector, and your bank in particular, identifying and catalyzing the possibility of Nigeria joining the manufacturing chain for vaccines and other health commodities? This is serious business. He has removed his mask.
Thank you. It is serious business. But I would start from where the real challenge used to be. I was exceptionally delighted when Dr. Mukhtar agreed that he was going to come for this event. And because people may not understand, but the most important part of solving this problem is to be in alignment with government. And it's also for the federal government to be in alignment with the state government, and then for the state and federal government to be aligned with the private sector. So solving that problem, having the people who are most important in solving the problem sit at the table, for me was a huge relief. Because it doesn't matter what commercial intent I have. If vaccine is not something you go to the market to just buy, it is something that is incredibly regulated, and every step of it, who can touch it, who can distribute it, who can administer it, is highly regulated. And as a financial institution, we will not touch it until that problem is solved. So for me, this is the most confident I have ever been that there is a private sector role in not just ensuring that we get vaccinated, but in solving for the issues of becoming self-reliant in vaccination. So that's an important one. The second one for me is the marketplace for vaccine. And so because of the nature of healthcare, and specifically public health, this is not one of the things that you also just throw to market forces. And so we have a situation where we're going to have coexisting in the same marketplace vaccine that is paid for free, either by the international community, that are paid for by the federal government. There will be vaccines that will be paid for by the state government. And yet, there must still be a space for vaccines that can be commercially viable, where private companies can come in and on the back of that, recover their money. It is coming with a framework that recognizes that none of the various sources of financing the vaccine will individually be sufficient, and therefore all of the sources of financing the vaccine should be legitimized. So for me today, if there is a clear framework that says that a company, a member of the Pharmaceutical Society of Nigeria, for instance, is authorized to be able to import or produce vaccine, and there's evidence that they can deliver on that, then I have every motivation to finance it. I do have the funding, but I need to be sure that because this is a highly technical space, everything that is required from a regulatory perspective is in place. And I'm confident that that will be in place. The second one is to also ensure that the public that are willing to pay to be vaccinated, and there are many, are also allowed to pay to be vaccinated at a price that is viable for whoever will handle that process, so that collectively we achieve the 70% coverage we are looking for. So yes, today we can. Final comment is that for the government, and this is directed at Dr. Mukhtar and to Honorable Commissioner, for as long as the government has a genuine commitment to put the money down, we in the private sector are willing to come up and advance the money while the government sort out how the money will be paid. So it's not a question of just saying, if today I get a letter from the federal government that says I need to put $20 million down so that the vaccine conversation can start, I will be willing to arrange the $20 million to be put down while the government figures out exactly where the money will come back from. Some of which may come from their budget, some may come from private sector contribution, but at least we get on the queue and we get in early. Thank you.
I think this is one of the most useful parts of the workshop like this. Very actionable suggestions from the people who can make it happen. And fortunately, those who can make that policy and framework come to life, the steering committee at the national level, also very well represented here. And thank you for that very inspiring contribution. And finally, with your regional multi-country hats as a health sector leader, you operate not just in Nigeria, you lead the private health federations in West Africa, and you're vice president of the African Healthcare Federation as well. Recently, there was the announcement of the African vaccine manufacturing concept, I think maybe about a week or two ago. And if we're looking at beyond just the immediate, how can Nigeria become a key player in that regional continental framework? What do we need to do as private sector, as government, to really give us a place at the table with a good voice that seems to have been eroding us in things like the Africa Free Continental Trade Arrangement and many things recently? What's your recommendation?
Thank you, Remy, for that question. This is something very close to my heart because I think one of the challenges we have living in sub-Saharan Africa is the fact that we're import dependent for almost every major need, from pharmaceuticals to medical equipment to commodities. And the way forward to get access to healthcare in the long term is self-sufficiency. So when it comes to the vaccines, we are so far away from where we should be as the African continent, and especially Nigeria. On the continent, there are probably about 4 companies that are manufacturing vaccines in Africa. We have in Egypt, we have in Morocco, we have in Senegal, and we have in South Africa. We had in the past the yellow fever production laboratory in Yaba, which is end-of-line equipment, dead and moribund. Having said that, government has in the past tried to put it together, and I know that there is a PPP in the process of trying to reactivate that. And I think, for me, that's the starting point. That the most important thing is the fact that we have a bigger policy called the African Continental Alliance, which is going to be able to make it one free trade zone across Africa. If we in Nigeria and sub-Saharan Africa do not have effort by our governments or by the West African Health Organization to have manufacturing in the region, we will become a net importer again. So I think it's a concerted effort of both the individual national governments as well as the West African governments, as well as Sub-Saharan African governments, to have the political will to have self-sufficiency. Now, we do not need to have everybody manufacturing the same thing. So Nigeria, for example, could be manufacturing COVID vaccines. Senegal could be doing the yellow fever. Somebody else could be doing, childhood immunizations. But whatever it is, we need to have a long-term, medium and long-term strategy. Again, you don't have to start with having all the capital at once. Remember, the first after political will is access to capital. We have the African Exim Bank. We also have various other regional banks that are ready to fund and are ready to provide grants in addition to funding at really maybe less than 2% in terms of interest rates. So the money is there, but they want to have the political will and they need to have an off-taker. The off-taker is that African governments need to make a commitment in the medium and long term to buy African, to buy made in West Africa, buy made in Nigeria. There is no need of setting up manufacturing in the country if your own government is not going to buy from you. So those are the 3 big things: the political will, access to capital, and then making sure that you have an off-taker, that you have a market in which you will sell the vaccines to. And I think those are the real big issues. Of course, we also need to think about the bigger issue, which is our universities, our research and development. We do not have enough institutes for research and development. I mean, the Lagos Biobank is probably one of the best things, if I may say, that has really scaled up. I mean, it wasn't totally developed just because of COVID, but it has really scaled up, and that's the beginning of research and development, that we here on the continent can differentiate what type of virus that we have and which variant it is. That shows that we're already there, but we have a long way to go to have academia merging with R&D, with pharmaceutical companies, doing clinical trials on the continent. There's quite a lot of work that needs to be done. And I think the initiatives of the African Union, of Afrexim Bank, and some of the other banks that we have, in African Development Bank, we all need to come together as one table and agree a short, medium, and long-term plan. And we, as I said, we do not necessarily have to go the whole capital mile. We can start with fill and finish. We buy the finished product in bulk. We just come here and package it. We fill the vials, we fill it, and then stepwise, we know that in 3 years, we want to be able to manufacture on the continent. The issue is we must take the first step. We must have the government commitment, the political will to do it, and private sector, as you heard, both the banking sector, private banking, is ready to support self-sufficiency, not only in vaccines, but also in PPEs, in pharmaceuticals. 70% of our drugs in Nigeria are imported from India and China. That's not sustainable. Another 3 or 6 months of lockdown, many of us will not have access to antihypertensives and some of the real technical drugs that we don't manufacture on the continent. So I think COVID-19 was the crisis that we needed to disrupt and think innovatively out of the box and have that strategic public-private partnership.
Thank you very much, Claire, for those very well articulated. Essentially, she could have been answering the question, what is the value chain for COVID-19 related response? And she's laid it out, not by the time of the vaccine alone, from the research stage, investing in the institution, Biobank, LASUTH, University of Lagos, Zaria, and all of those places, and all the way to making sure we have the right standards to be the source and center for clinical trials, because that's another part of the story. If you don't have a country that is recognized as a clinical trial destination, what you will have is data from other people that may not necessarily reflect the behavior in your own people. And these are all multifaceted things. Thank you for laying them all out. So this is it from the panel. And I'll just say that these are the table captains as we used to have in school. So Abu will be responsible for who will speak from column 1, Pamela, column 2, Professor, column 3, Dr. Mukhtar, column 4, and Claire for column 5. So your lottery is not at me, is at them. Indicate by show of hands if you would like to ask a question to any of the panelists. And Abubakar will pick the first person. On this column, does anyone have a question to raise? Okay, so you see your, I won't say bowl of porridge, but we go to the second column. No questions. This is what happens when you have stellar speakers. They've dazzled the crowd. Everybody is in awe of their presentation, but we have, no, it's not my regulation. Okay, she's the lone person. So it doesn't have to be to her. You will ask the question for this column. So I just want us to do the selection, and then the microphone can pass. And here, do we have any? I forget I'm not the one. Prof is chosen. Who do you choose, sir? Only? Yeah. Well, you can choose 2, because this column lost their chance. The lady in the bright red, your rainbow dress is working. And the guy with the blue mask, you struggling. Your struggle has paid off. So 1, 2, 3. On this column. Okay, you can have 2 from, okay, there's a late, okay. Doctor, do you agree? Him, okay. And in the last column, anybody? So we go back to the first column. There was a late person, okay, so behind there. Super. Sanitizer, microphone. We move round. So I'll start from the lady. You got yours? Super. Your name, affiliation, and then
Okay. Well, my name is Bonnie Lukwe. I'm a pharmacist and, a member of the Healthcare Federation of Nigeria. What I have actually is a comment, and, following up to what Claire just said, it's actually the fact that an enabling environment also has to be created for manufacturing of vaccines. And let me just zero in on something Claire said. Now, we manufacture vaccines here, but the environment, the enabling environment isn't created. And as such, the vaccines we manufacture is actually more expensive than the one we import. And that defeats the purpose of made in Africa, buy in Africa. It's just a comment. It's just something for us to think about. Thank you.
So was that hypothetical, that we manufacture vaccines? Are you saying, oh, okay, I get it. All right, that's has to be cost competitive. The second person was here.
Sorry. Good afternoon, everyone. My name is Aman Grover. I represent Grover's Hospital, which is one of the COVID treatment centers in Lagos. Just to add on one of the points Mr. Abubakar said, right? It's a consortium of two, the private and the government. Why can't we have something similar to the vaccine rollout, the way we had for the COVID testing, the way the government and the private sector has partnered, and in a way it has rolled out, in a way, some sense of successful outcome. So the proceeds from the private testing goes towards funding the government side of it, and that sort of quickens the process in testing, and same thing can be applied to the vaccine rollout if we have the two parties combining together. And to Madam Pamela Ajayi, you mentioned a point that the local hospitals, that's where the trust of the community is built into. So how can the government take these hospitals as a part of this network so that it can be effectively rolled out? Because as a person who stays in, let's say, in Ajayi, in Mushin, I'm more trusted to go to the hospitals I've been going since long. So till we empower these hospitals to actually carry out vaccine rollouts, I don't see we're going to be seeing a very strong effect of this. So these are the two questions I had for the both of you on how we can actually work with the government to take these things forward. Thank you.
Okay. Okay. So that's the question for Pamela and any of the national representatives. You need your mask. This is when you really need your mask.
Thank you. Good afternoon, everyone. My name is Olakweju Ibekoye, and I lead the Giving.ng platform, Nigeria's foremost charity crowdfunding platform. So my question goes to the representative of the minister and my honorable commissioner. So my question is this: if the private sector gets involved with vaccine sourcing and administration, the federal will be obviously stretched with education, administration, and governance. Should the states build capacity and take up this responsibility while the federal coordinates and provides oversight? And my second question is this: what are your views on what the states need to do to build this capacity? Thank you.
Good afternoon, everyone. I stand on existing protocol. So I'm Dr. Ajayi Talabi. I'm the MD of Pretty Healthcare. We are a private preventive health organization, and we're a vaccination company, actually, in the private sector. So if Dr. Claire brings it in, we give it. Now, my question is to Professor Abayo, the Commissioner of Health, and Dr. Mukhtar. I noticed that we've said we are making very innovative, we are taking very innovative steps in bringing the vaccines in. But I want to now ask about getting it into the hands of people because of hesitancy and other bottlenecks in access. So first is that, have you noticed, SARS, that as experienced as government is in giving childhood immunization, the government is the most experienced in that regard. Have you noticed that government is not as experienced in adult vaccination, because COVID-19 is an adult vaccination. So I don't know if you have noticed that gap, because unlike babies that will often follow their mothers willingly to the clinic, when it comes to adults, they are independent, they make their decisions, they have other priorities. So rather than ask them to come, sometimes you may have to go to them. The second thing is, if we notice that gap, because the private sector has been experienced in this, HPV, varicella, other vaccines that are not in immunization program are actually being given by the private sector already. So things like reminders, things like batching vaccination, things like cutting short the cold chain has been done by the private sector. So how do you want to leverage this? How do you want to do this? I noticed the commissioner saying that we give much less than we are supposed to be giving now. Sir, how do you want to close that gap? If you want to give 1 million per day, for instance, how do you, based on your projection, how early do you think the private sector should come in and you leverage the skill set that has already been established over the years with those other vaccines? Thank you.
Thank you very much.
Okay, I'm Dr. Olale Uluwafemi from Sterling Bank. I just have a few questions for the Honorable Commissioner. So we're talking about the cost of sourcing for this vaccine. So my first question is actually this: how much exactly do we need in funds to get the vaccines in? And seeing that we have a plan to achieve herd immunity in 12 months, how feasible is it that we'll be able to source those funds and be able to effectively distribute and administer the vaccines in 12 months? The second question I have is to Dr. Mukhtar. I wanted to find out if there's any plan to tax the citizens, maybe a COVID tax, to be able to raise funds. And if the answer is no, what other alternatives are there? Then my third question goes to the Honorable Commissioner, and it is, do we have any reliable data showing the impact of the ongoing vaccination that has happened, that shows, mortality amongst those vaccinated in Nigeria, to show that, okay, the vaccination is actually effective? And my last question goes to my CEO, and it is, given that purchases of vaccine causes capital flight from Africa and Nigeria, how do we, because historically, Africa is usually on the back foot. We always have to buy, and always causes our revenue, our capital, to go to Europe and go to America. And COVID is further widening that gap. What can we do in terms of generating products and services that will, generate forex for Nigeria? Do we tax Johnson & Johnson? Do we tax Moderna? Do we have, is there a plan? What exactly can we do from an economic standpoint to be able to, reduce that gap? Thank you very much.
Thank you very much. Are you in waste management? You're not. Okay. Because I see you don't like waste. So all the questions that were wasted here, you aggregated them and put them together. Was there anyone from here? I don't think so. Super. So the floor is open to our panelists. I hope you had a chance to take note of your questions, and we can start from Abu here.
Okay, just very direct answer to the last question. We are in a crisis, and therefore it's not the best time to strategize for medium to long term. Our immediate strategy is to survive the coming crisis. So I like to stay focused on how do we make sure that in 12 months or 18 months' time, we're not in a crisis that is so debilitating that the economy shuts down. That's the first one. As for the second one, a follow-up answer to that is that the way to help Nigeria, to help Africa, begin to earn significantly so that they can pay their way is back to healthcare, is back to education and healthcare. In fact, it goes back to what you know to be the focus of Sterling Bank, which is the heart sector, which is if we take care of healthcare, we take care of education, we take care of agriculture so we can feed ourselves, we take care of power through renewable energy, and we take care of transport, then our problem is solved. So yes, there is a medium to long-term strategy to make sure that Africa can take care of itself. But today, I ask that we stay focused on getting past this fairly dark period, and then subsequently we can, obviously not to say that we will not be planning to take advantage of the crisis, Claire has been very clear about the fact that this is a crisis that must not go to waste. And I think we've also been clear internally about how we must create the foundation for a different kind of healthcare sector. So that would be my answer.
Abubakar must have been a leader in the literary and debating society. Claire has been very clear. That was a deliberately played words. Nice one. Thank you. Dr. Ajayi.
Thank you. I'm answering the question for the gentleman at the back. It is actually very straightforward. The same principles that we used in laboratory testing can actually be applied here. All that we require is the will, the political will, and the determination to achieve it. So it would start, for example, with the building of a framework and regulatory framework, accrediting necessary institutions, education. And if you recall in some of my slides, the issue of education could be also, we could leverage technology and, expand the education across borders. So we're not just looking at Lagos State, we're looking across country. And in that case, it should actually be a very straightforward path to implementation. And I would also want to add on to the gentleman who spoke about vaccine hesitancy. With all that engagement of the private sector in all those different ways, you raise awareness, there's a lot of transparency in the process, there's a lot of people who are engaged in it. That also will ensure we build trust, because the whole issue of vaccine hesitancy is all about trust. So once the health workers and the people in the community are all engaged, it will engender far higher uptake of the vaccine. Thank you.
Thank you very much, Dr. Professor.
So I took some notes on the questions and comments. So I think what we realized from the models of the public-private partnerships we've established so far is that the capacity is definitely out there. And one of the things that government should be doing is defining the policy, preparing itself to regulate, but critically, creating an enabling environment for ease of doing business. And one of the things that will drive the private sector away like a bat out of in the night is if we subject the private sector to this horrendous bureaucratic mechanisms that bedevil civil service. So the reason why the model works so well in Lagos so far is because we've protected the private sector from those kinds of long drawn-out processes before they get paid for their services. And I think the private sector, find that to be one of the most attractive elements of doing business with government now in COVID. It's called the ease of doing business. So I think it won't be difficult to find the roles and responsibilities of all the players. The technical skills are out there, the infrastructure is out there, the technical know-how is out there, the government knows how to refine and define policies, the government knows how to enforce regulation. We just need to sift out the good from the bad and the ugly, as we heard earlier on, and just get on with the business of doing what we need to do to ensure we achieve the targets we want. And, with everybody, you see, why should the government pay for a service that an individual is willing to pay for? There's no point. The government this is not a communist country or a socialist country. It's, it's an open economy. And if somebody wants a service fast and has the resources to get it, then the government should create that opportunity, because then that injects the and galvanizes the economy. So, I think that, the private sector is well positioned. Of course, we need to look at the dollars and cents very carefully, but I don't see why government should go into debt to provide a service that citizens are prepared to pay for. And they're prepared to pay for it because it enhances opportunities for their own livelihood to be improved and increased. The very interesting question that came about the difference between immunization of children and adults. Yes, you're right. The primary healthcare platform is very experienced with doing routine vaccination. Now, in some countries, the vaccination program for COVID is not in the primary healthcare domain at all, because it's considered to be a specialized service, is considered to be a biosecurity issue, you're considered to be dealing with all kinds of issues that are not normally part of childhood immunization. So I'm not saying that the primary healthcare shouldn't be responsible, but it's more than what primary healthcare normally do. And therefore, either we create that support to the primary healthcare, or we just put it straightforward into the domain of the Ministry of Health and find all the key players that know how to pull the several facets of vaccination in a pandemic together, where there are multiple elements of biosecurity, security issues, hesitancy, chaos, and all the other issues that we've experienced around vaccination in Lagos. One of the biggest problems we've had is scheduling people for their vaccines. And it does require a very sophisticated digital platform to create the scheduling that takes people to the vaccination center at a broken up period of time that does not create congestion, chaos, and wherever there's congestion and chaos, you will find opportunists, and wherever you find opportunists, then you have those unsavory activities that have been circulating in the press and social media. The other issue around reliable data. So because we've vaccinated so few people, I mean, it really is a drop in the ocean. It's nothing. We can't really draw any conclusions other than scientific evidence trying to measure how the body is responding to the vaccine in terms of producing antibodies. And that research is ongoing at the moment. In Lagos, we have a very active research group that is put together specifically for COVID to understand COVID in its entirety. But particularly around vaccines, we all know that this vaccine was never trialed or tested in this population. So rolling out the vaccine had to be coupled with trying to simulate a trial to see what the adverse events are, how people of this ethnic group handle the vaccine. Is it efficacious? Does it create more adverse events? So we haven't just been injecting people, been doing a lot of case studies, a lot of research, and a lot of observation and data gathering, specifically to try and simulate a clinical trial around the actual rollout of vaccines. I think, with every person that gets vaccinated, whether in the private sector or in the public sector, you're adding to that number that will take us to our threshold. And if people want to acquire that vaccine on their own, outside of government's free distribution of vaccines, it all adds up. And I think at the end of the day, we must allow the economy to find its level for us to keep the economy rolling, ticking, and for even the opportunity to use the vaccination as a boost to the economy, so that it's not government draining itself and taking debts and loans, but actually government stimulating the economy by allowing the private sector to play, regulating them, making sure we sift the bad eggs from the good eggs, and ensuring that, you know, we're reaching our targets. I think that's it, really. Yeah, thank you.
Thank you very much. Let me just touch on some of the questions. The first one is, if we produce vaccine in Nigeria and the vaccine comes at a higher cost, well, the economists have spoken. I think it's not something to worry about. It's an obligation on the government to ensure that it thrives. So we'd rather put $10 or $20 extra on what we produce locally than for us to carry out all, shift away our hard-earned currency to another country. You don't need any this thing to know that. And government is committed to doing that. Government should be committed to doing that, to put in more resources locally. Actually, we did when the local manufacturing of PPEs started. We actively discouraged importation of PPEs. At some point, personally, I was even worried. These donations we were getting from Korea, from China, from whatever, was actually impairing the local production, you know, of these things. Well, there are donations, we can't reject them. But the approach is that if we can produce locally at a higher cost, we'll create more value chain, we'll create more employment, we'll create more opportunities for us, but putting that extra money in-house. So certainly government will not hesitate to put money in it. The collaboration you mentioned between public and private sector in the laboratory doing the testing, certainly that is the kind of collaboration we're looking forward towards for the vaccination. But for vaccination, we're looking at it its entire gamut, right from vaccine acquisition to the logistics, to the distribution, to the last level, and even to supporting the uptake. The private sector needs to make profit, therefore there is motivation. Government, there is no motivation for profit. It is a service. People are paid salary to do their work. Certainly the private sector will change the game if they start participating across the whole spectrum. Is government the best for adult vaccination? I think our Honorable Commissioner has answered that very validly. We have, from our experience, with this current vaccination that is going on, people come in to say, I don't want to go to this primary health care to take my vaccination. Can't I take it in this Turkish hospital or in Cedar Crest or in, you know, the highbrow hospitals in Abuja? And believe you me, many people would choose to pay 100,000, $500,000 to get vaccinated in the places they want than for them to go and queue up in a in a primary health care facility to get vaccinated. When they pay, the excess, you know, will be to vaccinate the rest of the public who could probably not afford. So it's really a welcome development, and Honorable Commissioner of Health has demonstrated that in Lagos with the testing. We have private testing for travelers where about 50,000 is charged. For the public sector, it is free. So we use the profit or the gains from the private sector to fund the the public testing for people who probably cannot afford. So again, that is the way to go. Taxation. Yeah, taxation is part of governance. I mean, you must pay taxes. But if you're asking of specific taxation for COVID-19, certainly that is not a welcome idea. Government has to raise funds and put its resources because, as we heard from the CEO of Sterling Bank, there is a lot of cost saving, or there is a lot of additional cost by not doing vaccination. And government has to do whatever is possible to ensure that we do not close up the economy, we do not allow COVID-19 to completely, devastate livelihoods of people. So it's really important to say that, yes, government has to put its fund, because no matter how hard it is for government to put that fund at this time, it certainly has a lot of advantage if you look at it in the future about the infections you prevent, about the deaths you averted, and even about the economies that you allow to flourish and to grow. Thank you.
Thank you, Dr. Mohammed. I think most of the questions have been answered already by the distinguished panelists, but I just want to probably put a little bit of emphasis on the point that was made by the gentleman from Grover Hospital, and how do you leverage on the experience of Lagos State with testing to leapfrog vaccination. I think the Honorable Commissioner has mentioned exactly what needs to happen as a blueprint. So to my mind, I'm going to wrap up in a slightly different way. I know there's a wrap-up session, but I just want to connect the dots. I think the first thing right now is public-public partnership, and that's happening as we speak. We have the federal with the presidency, and we have the foremost Ministry of Health that is at the forefront of really, leveraging on technology and innovation and engaging the private sector, having a conversation, and most importantly, endorsing that the way forward is private sector engagement. So PPP, public-public-private partnership. Then it is the PPP policy in this particular thing. I think the Honorable Commissioner again has said it. We need to have a framework and a policy for engaging private sector at the various stages of the value chain of vaccination, because there are different players. So the people that will be involved with acquisition, with importation, there are rules and regulations. We have regulators of NAFDAC. You have to comply with NAFDAC. You have to comply with PCN. You have to comply with the federal and the state ministries of health. And there will be a clear policy, which I'm sure Lagos State is, again, writing, or if not, have already written. Then we need to talk about the players who will be involved in the last mile distribution. Last mile distribution is totally different altogether. Who will ensure the cold chain? And across what we've said today, the word trust continues to come up. It's not about, a vaccine is not a drug. The way you deliver a drug doesn't really matter. It's not going to affect the efficacy. But if you break the cold chain, you will be delivering a poison on top of a poison. And therefore, it's important we make sure that the people who understand last mile distribution and cold chain, if it's 228, it's 86 degrees, are the same people involved. And therefore, government has a major role in regulation, working alongside the bigger regulators like NAFDAC and the Nigerian Primary Healthcare Development Agency. We need to do this together. The third leg for me really is the innovative financing that Abubakar spoke about. We need to think out of the box. And how do we, the rich that are ready to pay out of pocket, are already paying out of pocket, how do we leverage on that to pay for those that can't afford it? I don't want to use the poor. Government right now is struggling to pay for vaccines that we do not have it budgeted. There's no budget line for vaccines this year. So we have to use innovative financing. So if the private sector is able to bring in vaccines, for every vaccine that is used, there is a free vaccine donated to the states that are epicenters. Or there you go and leverage the same way we've done using technology, have a fixed price for the vaccine. That fixed price is a percentage that will go back to government for R&D, for reinforcement, for delivering vaccines. We need to think out of the box and use technology and use our existing framework to do what needs to be done. And finally, the Honorable Commissioner also said one of his pain points is post-vaccination pharmacovigilance. How do we make sure that these vaccines that we import, that are not made by us, are safe for our people? And therefore, we need to be able to monitor post-vaccination pharmacovigilance. We need to monitor the adverse side effects and adverse events. And we need to leverage again on technology. So we need technology that works, that can track and trace from the manufacturer to the distributor, to the primary healthcare center, to the primary provider, who is already accredited by the state. Remember, accreditation of the provider is done at the state level. So Lagos State will use her firma to do the registration. The other states will need to engage, of course, the same way. And they're out of 1,000 providers in Lagos, they may choose 20, then 40, then 50, and we go on like that. But the pharmacovigilance is just important. We need a push and a pull. So we need to leverage on a tool that fits into the federal government system, which is the DHIS, and we need to get data, and we need to get pharmacovigilance, and we need to make sure that we get a travel card that will make Nigerians able to travel and open up our economy again. Thank you.
Almost feels like there's nothing to add. With such a fantastic panel as you've been privileged to listen to today, the organization, if I tell you that the time between conceptualization and holding this meeting is all of 1 week or 6 days. Even I was doubtful that how can you convene this? But the power of the belief, the power of partnership, and the power of focus. So if you will go away with any words, I'll choose one of the words that Abubakar used, which is focus. You see, in a challenging situation, it's easy for your mind to drift and want to solve all the problems. You're not going to ever be able to do that. The focus right now is on vaccination, is on closing the gap, is on getting the vaccine into the arms. And that must guide every action that we take. Thank you very much, distinguished panelists. As a way of ensuring that this doesn't end as a talk shop, the proceedings of today's session are being compiled. Rapporteurs are in the audience who have taken all the notes. A communique will be produced under the auspices of the Healthcare Federation of Nigeria and in collaboration with all the partners, Sterling and all the others who have participated, and will be delivered to the presidency through your good self, Dr. Mukhtar, who's physically present, and ensuring that all your colleagues in the national level, at the MPHCDA, at the ministerial level, also key into the very useful resolutions we've had here. Thank you for your time, and it's only left for me. Thank you very much. It's left for me to invite to do the wrap-up of the entire day's proceedings, the Divisional Head of Health and Education at Sterling Bank, Mr. Obina Ukachukwu. And as he makes his way, I'll just make a couple of housekeeping announcements. After the wrap-up, the panelists will come to the media board for a group photograph with social distancing as best as possible. After that, they'll head to the buffet and take their meals, and we would need to have, there's stools there. So they'll come right back here and have their meals. And then we'll go table by table to ensure there's no congestion at the buffet center. I hope it's been a wonderful day for you as it has been for me. Thank you, and enjoy the rest of your day.
Thank you, everyone. Thanks, the audience. Thanks for being a very good audience. Thanks those online. I know there are people online watching. We say a very big thank you. And to our panelists and our speakers, Abubakar, Dr. Pamela, Honorable Commissioner Prof. Abayomi, Dr. Mukhtar, and Claire. Thank you very much. We can't thank everyone. We have our partners here, Zipline, Drugstock, Helium Health, Vaxifarm, we didn't put you here, but you've always been there. Tremendoc, Giving, HFN. Like the moderator said, we're going to come up with a communique through HFN, who's our major partner here, and we will present it after, I think we should do that within a week of this particular meeting. To everyone that organized this, I want to say a very big thank you. I couldn't imagine that we could pull this across in 6 days, but it just tells you that we're actually an emergency. 2 billion people have been vaccinated in the world, and Africa is just somewhere down there, and Nigeria is somewhere below, below Africa. So it's an emergency, it's a vaccination world that we're in, and we're focused to delivering on it. Thank you very much. After the picture that's going to be taken here, would actually want the speakers to just go to the media booth so we can take clearer pictures for the media. Then you'd have your lunch, and that would be good afternoon, and do have a nice weekend. Thank you very much. So we just do a photo. Where is Abubakar? Where is Abubakar? Yeah, please, let's just have one here. They stand up here before they go back, just to have the backdrop.